Good day, fellow seniors. Have you ever wondered how often elderly people should really bathe? Is the answer as simple as you might think? Welcome to a surprising article about the bathing habits of older adults. We often easily assume that daily bathing is a given. However, today we will lift the curtain on this misconception. Let's explore the shocking truth about the actual frequency that elderly people should bathe. This might completely change your perspective on cleanliness and health. I'm Dr. Frederick, with over 20 years of experience working with elderly patients. Most of us grew up with the belief that daily bathing is a must. It's a habit ingrained in our minds since childhood, much like having a cup of coffee in the morning or reading the news every day. Who doesn't enjoy the fresh feeling of stepping out of the shower with soft skin and the light scent of soap in the air? This belief not only runs deep in each of us, but has also become a global cultural standard. From bustling cities like Tokyo or Paris to small towns in Belgium or the American West, daily bathing is seen as an important part of personal hygiene, almost as natural as, the appearance of the sun each morning. However, there's one thing you might want to reconsider. Although this habit is very common, is it truly suitable for everyone? We all have our own preferences when it comes to food, music, or fashion, and each person's body has unique needs when it comes to self-care. Especially for older adults, the habit of daily bathing may not provide the benefits we once thought. In fact, experts recommend that elderly people should bathe only once or twice a week. Yes, just once or twice, of course. This depends on the level of activity and health condition of each individual. Before you're surprised, let's explore the reasons behind this advice. As we age, the production of natural oils in the skin decreases, making the skin drier and more prone to irritation. These oils play a crucial role in keeping the skin moisturized and healthy. When we bathe too often, especially with strong soaps, we may strip away this natural oil layer. This causes the skin to become dry, cracked, and more susceptible to infections. Especially for the elderly, reducing bathing frequency can help protect the skin better, preventing moisture loss and maintaining the body's natural protective layer. In addition, another important factor is safety. The bathroom, especially the shower and bathtub areas, is a high-risk zone for falls, particularly for older adults. These areas are often very slippery due to water and soap. Without proper safety support, bathing can increase the risk of falling, especially for those with balance issues or weakened health. According to a study from the Centers for Disease Control and Prevention, CDC, nearly 1/3 of people over 65 fall each year, and many of these accidents occur in the bathroom. Therefore, reducing the frequency of bathing can help minimize these avoidable accidents. Moreover, some health issues can also be affected by bathing too often. For instance, people with respiratory conditions may find it harder to breathe in the humid environment of the bathroom. Those with arthritis or other mobility problems might also experience difficulties and pain while bathing. However, for some elderly individuals with health issues, such as incontinence, maintaining high personal hygiene is crucial in these cases. Rather than bathing daily, they might use alternative methods like sponge baths or wet wipes to maintain cleanliness without facing the risks of frequent bathing. It's important to note that each elderly person has different needs and health conditions, so there is no one-size-fits-all rule. Bathing frequency depends on health lifestyle, observing, and individual needs. Therefore, it's best to consult with a doctor or healthcare professional to choose the appropriate and safe hygiene methods. Thus, reducing bathing frequency can indeed be beneficial for the health and safety of older adults. However, how can they maintain good hygiene without facing unnecessary risks? In the next section, we will share practical hygiene tips to help older adults keep their bodies clean and healthy. Maintaining hygiene does not always mean bathing every day. This may be a perspective that surprises many, but the truth is that hygiene is not just about appearances. It is also closely related to overall health, especially for the elderly. Daily bathing may not be the best solution, as it can sometimes cause more difficulties, not only physically, but also internal terms of health. So how can one maintain good hygiene without having to bathe every day? Let's explore some reasonable alternatives. First, a very convenient option is wet wipes, not just for children. Adult wet wipes can be an effective way to clean the body without needing a full bath. They are gentle on the skin and can be used to wipe the face, hands, body, or even underarms. Wet wipes are also very convenient and easy to carry, allowing you to maintain a fresh feeling anytime and anywhere. However, when choosing wet wipes, make sure to pick fragrance-free and hypoallergenic types to avoid skin irritation. Next is hand washing, one of the simplest yet extremely important measures for maintaining hygiene and preventing bacteria and viruses. Whether you bathe daily or not, washing your hands with soap and warm water for at least 20 seconds will effectively remove dirt and bacteria. After washing your hands, remember to dry them completely to avoid moisture, which can promote bacterial growth. Additionally, always carry hand sanitizer for situations where soap and water are not available. Oral hygiene is another crucial part of your daily hygiene routine. Brushing your teeth at least twice a day and using dental floss regularly will help prevent cavities, gum inflammation, and other oral health issues. In addition to brushing, you can use mouthwash products to keep your breath fresh and boost your confidence. Clothing hygiene also plays an important role in maintaining a clean feeling. Changing clothes daily not only helps you feel comfortable, but also creates a protective layer for your body against dirt and bacteria. Additionally, regularly changing bed sheets and pillowcases helps keep the sleeping space clean and fresh, improving the quality of your sleep. Finally, taking care of your appearance, such as getting haircuts, trimming nails, or shaving if applicable, is an essential part of your hygiene routine. This not only helps you feel clean, but also boosts confidence and helps you look neat and healthy. In conclusion, maintaining good hygiene does not necessarily have to be linked to daily bathing. The important thing is to find a hygiene routine that suits each person's health, lifestyle, and physical condition, with alternatives like using wet wipes, frequent hand washing, maintaining oral hygiene, and caring for your appearance. You can still stay clean without facing the potential risks of bathing too often. Hygiene is not just about looking clean on the outside. It's also about taking care of your health and creating a sense of comfort and confidence in daily life. Ultimately, hygiene is a very personal matter, and there is no one-size-fits-all solution for everyone. Let's summarize the key points we've explored in today's video, starting with the intriguing question: how often should elderly people really bathe? We've learned about the misconception that daily bathing is a must for everyone, regardless of age. However, through research and expert insights, we now understand that elderly people do not necessarily need to bathe every day, contrary to common belief. Frequent liquid bathing can strip away the natural oils that protect the skin, causing it to become dry, vulnerable, and prone to infections. This truth may surprise you, but it makes perfect sense when we consider that our skin changes over time. As we age, our skin becomes thinner. And that was it, Benji. Did I miss anything? Produces less oil, and frequent bathing only exacerbates dry skin. In fact, bathing every 2 to 3 days may be a better option for maintaining healthy skin and avoiding skin issues. Additionally, we've shared some effective hygiene tips for older adults, such as using mild soap and moisturizing regularly. While daily bathing is not necessary, cleaning key areas of the body, like the face, armpits, and groin, is still very important. This helps maintain hygiene without stripping away the skin's natural protective layer. Now remember, the frequency of bathing is not the determining factor. It's how you maintain hygiene in a way that suits your health and personal needs. The most important thing is to keep your body clean and healthy, and each elderly person can find the hygiene routine that best fits their health condition. If you found this video helpful and want to explore more information on other health topics, don't forget to subscribe to the channel to stay updated on future videos. We'll continue sharing valuable knowledge and advice to help you take care of your health effectively. And safely subscribe now and don't miss out on our latest videos.